So if I see somebody that has an empyema or they have fevers, chills, elevated white count, and you're suspecting an infected space, then I will put a pigtail chest drain in, because really the crux of the situation is, one, you're going to need source control, which is clearing out the pleural space, and two, you're going to need antibiotic management. And this is where a multidisciplinary team can be super helpful, because if the patient has a thickened pleural rind, or if you're not able to evacuate the fluid all with just a simple drainage or a chest drain, then you're going to have some questions of what is our next step. So this is where you need to talk with your interventional pulmonologist, your thoracic surgeon, and your infectious disease doctor to come up with a good plan as far as, what the next step is. And this is where we can kind of bring in some of the literature. So MIST 1, which was published now quite a bit ago, looked at using streptokinase in the pleural space as an adjunct to chest drainage to see if it would improve radiographic outcomes or referral for surgery. It ultimately did not, but it did set the groundwork for MIST 2, which was a very cool study. It was a blinded 2x2 factorial study that enrolled 210 patients, and the patients got one of four things. They got a chest drain, which is standard of care, plus either placebo, tPA only, Dornase only, or tPA and Dornase in combination. And based on the fact that you've been on wards, you probably know who won that one, which was tPA Dornase actually did improve both radiographic outcomes and decrease the need for surgery. There were no effect on mortality or hospital length of stay. So a lot of times it's my first line in patients, because going through a VATS pleural decortication is a tough thing for a patient to do. So if you can use a medication that, generally speaking, is pretty safe to try to clear out the pleural space, then it's probably worth a shot. But I also think this is where you need to talk with your thoracic surgeons too, and make sure, like, hey, this patient's an optimal candidate. Would you, and take the patient's needs into account too, should we just go straight to surgery? And so that is the appropriate thing in some cases. But I do think practice is changing to hopefully using kind of more minimally invasive stuff to start with. The caveats to using tPA Dornase, I think, are one, if you have a really thickened pleural rind, it's not going to be effective at decorticating or getting rid of that pleural rind. So the patient's going to have some lung entrapment. These medicines are not going to fix that. Two, there was a very good retrospective review of a very large data set done recently by Jason Akulian and some other colleagues that looked at the safety of tPA Dornase. Essentially, the bleeding rate is pretty low. It was somewhere between 2 and 4%. But if your odds ratio for bleeding from tPA Dornase out of the pleural space goes up if you cannot stop anticoagulation. So in those situations, you should really consider dose reducing or maybe not using it. So then, I think in those situations, let's say you don't have a pleural rind, there's no systemic anticoagulation. In those patients, it's usually worth a try. We still haven't optimized the dosing schedule necessarily. In the MIST 2 trial, it was Q12 for 3 days. I don't think everybody needs Q12 for 3 days. So I think, you give a dose or two, check either with ultrasound or X-ray and see how the pleural space is doing. And if the lung is re-expanded, you can probably stop.
Awesome. Yeah, I think for the patient I saw in the wards, we probably I think that I did it twice, and then they were like, okay.
Yeah. So, I think that's where using randomized data is great, but you don't necessarily always have to fit into that. I think you want to consider the patient at hand. And if 2 doses works, great. But if you're getting good results from it and there's still some work to do, then go ahead and give the full 6. I will say there's probably a law of diminishing returns after 6, and it's probably worth considering something else at that point if it's not effective.